The 6-minute walk test is a test used for a variety of rehabilitation or diagnostic type tests. The original purpose was to test exercise tolerance in chronic respiratory disease in patients with heart failure, to record their oxygen saturation curve, but it can also be used for elderly patients with joint or bone issues for exercise reasons. In this video, we will be discussing the cardiopulmonary aspect of this test. During this test, you will need a pulse oximeter to measure the patient's oxygen saturations, a timer to record the amount of time they walk, preferably 6 minutes, and occasionally you'll need a chair to follow the patient with in case they need a break or need to sit down quickly, or a oxygen source in case their sats drop that they need oxygen. You'll also need a straight hallway to walk with the patient, and preferably before you want to measure out how long the hallway is so you know that each lap they do, how far that is. To start the test, the RT will explain to the patient that they will walk as far as possible in 6 minutes. They can slow down or rest as needed. A starting SpO2 should be measured, and if the resting SpO2 is less than 88%, the test should not continue and oxygen should be given. Their blood pressure should also be taken, and if the systolic blood pressure is greater than 200 or less than 60, and the diastolic is greater than 110, then the test should not be continued. If the heart rate is greater than 120 or less than 50 beats per minute, then the test should not be continued. Before starting, you should ask the patient if they feel out of breath or experiencing any chest pain. Are you out of breath or experiencing any chest pain?
No, I'm not.
Okay. And her heart rate and blood pressure and sats are all good. So before you want to explain to the patient what exactly this test is, the object of this test is to walk as far as possible in 6 minutes. You will walk back and forth in this hallway. You might get out of breath or become exhausted. You can slow down, stop, and rest as necessary. Resume walking as soon as possible. I will keep track of the amount of laps that you walked. Remember to walk as far as possible for 6 minutes. You can start as soon as you're ready. Are you ready?
I'm ready.
All right, let me get this first. Okay. All right. I'm gonna let you lead. No, I don't like you're walking in a funeral. Just let us pass. Yeah, just stand over here somewhere. No, I'll just say I did. Yeah, that's fine. Follow us. Okay, stop here. Come on. Just wait. While doing the test, you should make sure that you should let the patient know that they're doing a good job. Also let them know how much time has passed. You should also not lead the patient. Let them go first and go at a speed that they are comfortable with. You should never encourage the patient to go any faster. You need to ask the patient during the test if they're feeling okay, experiencing breathlessness, or are experiencing any chest pains. Some reasons for immediately stopping the test would be if your SpO2 falls below 80%, the participant asks to stop the test, the patient has chest pain, intolerable dyspnea, leg cramps, staggering, diaphoresis, pale or ashen appearance. During the test, if the patient drops below 88%, you need to record the distance at which it drops.